To explore the suprascapular nerve, the first thing is to identify the conoid and the trapezoid ligament. These arise from the part of the clavicle, and you can follow the base of coracoid with that. Once you harvest that, you will see a vessel which is the suprascapular artery, and just underneath this vessel you will find the transverse scapular ligament. You need to erase this area. So here we are working, looking from the lateral portal and working from anterolateral portal, and we can use a Nivasier portal to do a dissection. So here we are coming from the Nivasier portal and dissecting the transverse scapular ligament. So here just underneath the artery we can visualize the base of the coracoid and we can see the transverse scapular ligament. So here it is very important to dissect it thoroughly, and here we can see that this is the transverse scapular ligament coming into the picture, and we can see the nerve right underneath the transverse scapular ligament. The nerve is covered by the fat. We need to do a little dissection in this part and just do a teasing movement from the Nivasier portal to see, and you can see the suprascapular nerve coming into the picture just underneath the transverse scapular ligament. So here this is a very important point. You need to dissect it thoroughly. The artery is above the transverse scapular ligament, the nerve is underneath it, and if you want to release the nerve you can just use your Wissinger rod as a dissecting instrument, and then you can cut it by using a arthroscopic scissors. So here what you can appreciate is the transverse scapular ligament is the portion which needs to be emphasized and which needs to be dissected slowly. So once you are able to dissect the transverse scapular ligament, you will be just cutting it at its coracoid end, and then the underneath suprascapular nerve you can release. So here you can see that you can just release the transverse scapular ligament in the picture. So here what we are doing is, here you may need to be careful for about the bleeding. So occasionally these will bleed a lot, and here we are coming up with an arthroscopic punch or arthroscopic scissors, and we release the transverse scapular ligament towards the coracoid, and when you pull it you will see the nerve just lying beneath it. So the nerve is here and the nerve is released, and we recommend this procedure in all those patients who have a large massive rotator cuff, and if you release it you can see the small little vessel also which is going over the nerve sheath. So here we have done a thorough release of the suprascapular nerve, the artery is above it, and this is an important procedure if you are addressing any massive cuff tear. Thank you. If you need any more questions you can just ask us.